Welcome back to the Deep Dive. Today, we're stepping into something huge, really.
Yeah.
The future of Canadian healthcare, and specifically, the role artificial intelligence is playing.
Yeah, it's everywhere now, isn't it?
It really is. And it promises so much.
Yeah.
Faster diagnoses, better efficiency, miracles almost.
Yeah.
But there's this flip side, these warnings. What happens when these incredibly powerful tools maybe go too far? What's the cost to trust, to fairness, to that human touch in care? That's what we want to get into today.
It's definitely exciting. I mean, the potential is undeniable. Quicker assessments, less admin work for doctors and nurses, maybe genuinely better health outcomes.
Right.
But that question you just asked it's the crucial one. With all this power, what are the responsibilities? What are the real risks if we don't deploy AI carefully, transparently, with people first?
Okay, let's unpack that then. Our mission here is to really explore those challenges, the ethics around AI in Canadian healthcare. And we're leaning on a really insightful blog post for this. When AI overreaches, holding the line on trust, equity, and care. It uses recent research, policy discussions, and crucially, provider experiences. Gives us a great starting point.
And for you listening, this isn't just like theory. Understanding these potential problems is, well, it's essential. It's about making sure AI actually helps, right?
Yeah.
That it builds trust, not breaks it. We don't want misdiagnosis or making existing inequalities worse or just losing faith in the system. This stuff affects real people, real care.
Let's jump right in then. The first big one, the one that probably keeps a lot of us up at night, patient privacy.
Always number one, yeah.
I mean, just think about it all, your most sensitive health data. Your history, scans, lab results, even maybe tracking your behavior. All feeding these algorithms.
Yeah.
Algorithms making huge decisions. What happens if that data isn't secure? How do we protect it when AI needs so much of it?
Well, that's the vulnerability, isn't it? The sheer amount of data AI needs just opens up new ways for things to go wrong. And the numbers are pretty sobering.
How bad is it?
Well, in 2023 alone, Canadian hospitals and their vendors reported over 700 healthcare data breaches.
700.
Yeah. Exposing over 50 million patient records, often ransomware or problems with third-party systems. That's a huge chunk of the Canadian population potentially exposed.
50 million, wow. That's not abstract at all, is it? That makes it very, very real for a lot of people.
It really does. And we saw a specific example, right? The Autonix remote care platform breach exposed data for over 100,000 patients across dozens of clinics in Ontario.
Okay.
These aren't just one-offs. It points to a bigger challenge, and maybe even more telling is this 2024 survey. It found only 21% of physicians actually trust AI to keep patient confidentiality safe.
Wait, only 21% of doctors?
Yeah, that's incredibly low confidence from the people on the front lines.
That speaks volumes, doesn't it, about where things stand right now?
Absolutely. And look, Canada has privacy laws like PIPEDA for the private sector and FIPA in Ontario for health info. They require consent, responsible data use.
Well, the rules are there.
The rules are there, but the reality is many AI tools kind of operate in these gray areas. Communication about how data is really handled is often limited. Patients, even doctors, might not be totally clear on what's happening with their most sensitive information.
And this isn't just about legal boxes to tick. This is trust. It's the absolute foundation. If people don't feel their information is safe, why would they use these new digital tools?
Exactly.
It risks safety, and it could completely stall the progress AI promises if people just opt out.
Precisely. And once trust is gone, getting it back is incredibly hard.
Okay, so beyond privacy, there's another huge worry. Fairness. Equity. What if AI actually makes existing health gaps in Canada wider? We have such a diverse country. Indigenous communities, immigrants, racialized groups, people in rural areas, all with different needs. How could AI, which is supposed to help, end up making things more unequal?
That's a critical point, and it comes down to how these AI systems are built, the data they learn from.
Right. Garbage in, garbage out kind of thing.
Sort of, yeah. If the data sets used to train AI don't represent everyone, especially these diverse communities, then the AI learns those biases. It carries them forward, making existing disparities worse.
Okay.
There was a 2024 study, Frontiers in Public Health. It found exactly that. A lack of representative data and transparency in Canadian public health AI. Big concerns about built-in bias. If the AI hasn't seen diverse data, it won't work well for diverse people.
So like an AI trained mostly on data from white men in cities might totally misread symptoms in an Indigenous woman living remotely.
That's the risk, absolutely. The Northern Ontario School of Medicine actually noted AI tools often struggle in Indigenous and remote communities because they just aren't adapted to the local health needs or social situations. The models don't get the context. And groups like CIPP and the Brookings Institution keep pointing this out. Biased training data leads to worse outcomes for racialized and rural folks. It's not just theoretical, it's happening.
And the consequences are huge, right? It means delays in diagnosis, care plans that don't fit, and basically breaking trust again, especially in communities that might already be wary because of past experiences.
Yeah, and when trust goes, people don't seek care. It widens the gap even further.
Okay, let's shift gears a bit. This next risk feels almost backward. We think AI makes things better, faster, smarter.
Right.
But the source talks about automation bias, this tendency we have to just trust the machine, even when it's wrong. This is where it gets really interesting, I think.
It really does. It's a known psychological thing, automation bias, and it happens even with experts. A 2023 study looked at doctors reading MRI scans for knee injuries, ACL tears. AI help did improve overall accuracy, which is good, but, and this is the key part, in almost half, like 45.5% of the mistakes the doctors made, it was because they showed automation bias. They over-relied on a wrong AI suggestion.
Whoa, hang on. So the AI helped overall, but nearly half the errors were because the humans just went along with the faulty AI. It's like the computer says jump, and the doctor says, okay, without double checking. That's kind of scary in medicine.
It really is. It shows how easily our own judgment can be nudged, maybe subconsciously. Another study in 2024 on AI helping assess wounds. Non-specialist clinicians deferred to bad AI judgments more often than you'd expect. And maybe the most direct example, a Canadian study where pathologists actually changed their correct cancer assessments in 7% of cases because of wrong AI output.
They changed a correct diagnosis because the AI said something different.
Yeah, it's not just about the AI missing things, it's about it potentially making humans second-guess their correct instincts.
Man. This really shows why clinical expertise has to stay in the driver's seat, doesn't it?
Absolutely.
If AI starts undermining human judgment, even subtly, the risk of wrong treatments just shoots up. So training, being able to audit the AI, understanding why it made a suggestion, explainability, all that becomes non-negotiable. It has to augment, not replace.
Leverage the power, but keep humans in control. That's the goal.
Okay, and speaking of human control, let's talk about the really human part, empathy.
The heart of healthcare.
We've covered data, bias, judgment. But what about that connection? That feeling of being understood that's so crucial for healing? Can AI, no matter how smart it gets, ever really do that?
That's, yeah, a million-dollar question. AI can definitely be programmed to mimic empathy, right? To use the right words, generate what sounds like a caring response.
It can sound convincing sometimes.
It can. But does it have genuine emotional understanding, real cultural sensitivity? Probably not. Our source mentioned a 2025 study where people consistently preferred stories written by humans over AI chatbots, even when the AI was rated as somewhat empathic. It's just something different, a quality that humans picked up on.
So it's more than just the words, it's the feeling behind them, the real intent.
Exactly. And another study, 2024, looked at digital empathy for cancer support chats. It found AI suggestions for empathetic phrasing could be helpful for the human support person.
Okay, like a prompt.
Yeah, like a prompt. But the real connection, the authentic empathy, needed ongoing human adjustment, reading the situation, understanding cultural nuances. Things only a trained person can do. AI gives a script, the human delivers the performance tailored to the moment.
Right.
And while, yes, some experiments mentioned in a New Yorker piece showed ChatGPT sometimes got higher empathy scores than doctors in blind tests.
I remember reading about that.
Yeah, but critics rightly pointed out those tests often miss the bigger picture, the relationship, the history, the nonverbal stuff, everything that makes up real-world care. Empathy isn't just a text response, it's presence.
And that's why it matters so much. Empathy isn't just nice to have fluff. It builds trust. It gets patients engaged in their own care. It supports mental health during tough times.
Absolutely.
AI might fake it till it makes it in some simple tasks, but for complex healing journeys, you need that real human understanding. Without it, even the best tech can leave people feeling alone.
That human touch, yeah. You can't replicate it.
Truly. Okay, let's tackle the last big risk area, which is maybe the most technical. The black box problem.
Ah, yes. The mystery machine.
Right. If we can't see how an AI reaches its decisions, how can we really trust it? Especially when health is on the line.
It's a massive barrier to trust and adoption. These opaque models, these black boxes, they spit out an answer, but they don't show their work.
Like magic, but maybe not the good kind.
Exactly. Imagine your doctor saying, the computer says you need this surgery, but they can't explain why the computer says that. Would you disagree?
Probably not. I'd want to know the reasoning.
Precisely. And the Vector Institute's report from late 2024 said just that many Canadian healthcare AIs are opaque black boxes, and that directly hurts trust and makes it hard to check if they're even working correctly. CIGI, the Center for International Innovation Governance, also flagged transparency and accountability as major gaps. And even though Canada passed the AI and Data Act, AIDA, in 2023...
Right, the new law.
Yeah, a lot of the detailed rules, the transparency standards, the audit requirements, they're still being figured out. So right now, healthcare AI is often operating without that clear guidance. It leaves a gap where trust can just disappear.
And this matters deeply because, well, informed consent needs clarity, doesn't it?
Fundamentally.
Trust needs clarity. If patients and doctors can't understand why an AI suggests something, they're flying blind. It undermines safety, patient choice, and even things like legal responsibility. If something goes wrong, how do you investigate if the black box won't open up?
That lack of explainability is a direct threat to trust and to safety.
Okay, so wow. We've hit on some major potential downsides today. Privacy leaks, bias amplifying inequality, automation messing with judgment, the limits of AI empathy, and these black boxes. It really begs the question, how do we make sure AI actually helps people, enhances care, instead of causing harm?
This is where the idea of human-led AI really comes in. Our source highlights a group called Serefin Health as a kind of model. The core idea is simple. Technology supports, it doesn't replace, human insight and connection.
Okay, so what does that look like in practice?
It means building in safeguards from the start and constantly monitoring. Like at Serefin, every single AI suggestion gets reviewed by a trained human care coordinator. They contextualize it.
Ah, the human in the loop.
Exactly. The AI assists, it doesn't decide on its own. That's a huge difference.
Yeah, it puts the person back in charge.
Absolutely. And then there's rigorous testing before anything goes live. Clinical validation, stress tests, fairness audits to check for bias.
Okay.
And it doesn't stop there. Ongoing oversight with real-time dashboards, audit trails, constantly tracking how the AI is doing, flagging weird results, plus informed consent is key. Patients are told clearly when AI is involved, and they can always say no.
Giving people agency right from the start, not just explaining after the fact.
Precisely. And to tackle bias head-on, continuous assessments. Checking the models for fairness across age, race, gender, location, health status. Trying to catch and fix inequities before they impact care.
Makes sense.
And finally, acknowledging what tech can't do. Training the human teams in cultural safety, responsiveness. The things AI alone just can't deliver.
I really like how the Serefin team put it in the source. AI supports decisions. Humans guide care.
That sums it up perfectly.
That is Serefin's unwavering commitment. It really drives home that thoughtful, transparent, empathetic integration is the only way. Building AI that reflects our values, accessibility, equity, trust, by keeping people firmly at the center.
It's the only responsible path forward if we want to really harness AI's power for good.
So wrapping up this deep dive, it's undeniable, isn't it?
Yeah.
AI holds incredible promise for Canadian healthcare. Faster diagnoses, smoother systems, potentially better outcomes.
The potential is huge.
But, as we've really dug into today, the risks are just as real. Privacy, fairness, judgment, empathy, accountability. These aren't small things.
Not at all.
Yeah. And it seems like responsible innovation has to start and end with putting people first every single time.
And that brings us to maybe a final thought for you, the listener, building on our source. As AI inevitably becomes more woven into your healthcare, ask yourself, are you fully informed? Are you really consenting to how your data is used, how these tools influence your care?
Yeah.
Is AI supporting the professionals caring for you, or is it maybe subtly overwriting their judgment? Because at the end of the day, no matter how advanced the tech gets, quality care, compassionate care, it starts and ends with human connection, with trust, with that invaluable human touch.
Couldn't agree more. Thank you for joining us on this deep dive. We hope it's giving you plenty to think about regarding how technology can and should serve humanity, especially in something as vital as our health. Until next time.